I have known him for 24 years. I knew him first as my teacher at the family medicine residency at the University of Utah. And my favorite thing that I learned from Dr. Babbitts at that time was about community-oriented primary care, which really means not just being a primary care clinician, but also really listening to what's needed in your community to make the difference in health. And I've carried with me through my practice, through my time now in public health, and it started with Dr. Babbitts. He has always stood up as a primary care clinician and advocated exactly the way you would expect a family doctor to advocate for primary care, for prevention, for cost-effective care, for everyone to have care. And I've always looked up to him as a leader in organized medicine. He has stood for the expansion, the affordability of going into primary care, going into family medicine, has advocated for rural practices, for urban practices, and himself practiced at the health clinics of Utah, where I actually get to interact with him now, and his patients absolutely love him.
When I joined the Department of Health in August of 2019, I first began hearing of Dr. Babbitts. He was a deputy director with the Department of Health at the time. That in itself, the position commands respect. But over time, as I got to know him more, I understood that he had lived this life of the programs that our office was administering. So one of his early positions was as a National Health Service Corps family doctor, living in rural Northern California. So, working within the National Health Service Corps. From there, he went on to positions at the federal level with the National Health Service Corps, and then came back as, the work that he's done with health clinics of Utah. There, he's continued to live this life of service to rural and underserved populations throughout his career. And so that made his advice and guidance and support that much more valuable for us. But he was someone that I always knew that I could turn to for good advice and practical advice on how our programs might continue to help those populations that he had been serving throughout his career.
Dr. Babbitts has been our biggest champion at Health Clinics of Utah. So he always fights for patients, and patients come first. And that is one thing that is his biggest mantra, and that he always reminds us of, is that we're here to serve the patients. And we see underserved patients here that maybe haven't been to a doctor for 10, 20 years and have 5, 6 chronic conditions, and he is so patient with them and just puts them first. But he's constantly having to battle to keep our clinic doors open. And our biggest champion and our biggest knight in shining armor out there is Dr. Babbitts. So at the drop of a hat, he can tell you everything wonderful about being a family practice primary care physician, how important it is to have a safety net. Where are these patients going to go if there aren't people there to care for them? But he goes where he's needed the most and where his passion drives him. And that is in family practice, primary care medicine, working with the underserved and the people that need it the most.
What I have admired about Dr. Babbitts is his compassion and caring for people, patients particularly as a physician, but as an administrator with public health department, he was very supportive and caring and compassionate with coworkers, with those he directed and those throughout the department. That's why I selected him after I became executive director of the Utah Department of Health as a deputy director, because he was such a great example, very intelligent and knowledgeable, but first of all, a great person, and so good as a director and manager of people in public health. Dr. Babbitts has, when he started with the Utah Department of Health, he was put in charge of Health Clinics of Utah. Dr. Babbitts has really been a champion of making sure we have primary care for people who really don't fit into primary care in some other way. And Dr. Babbitts has been the director of these clinics for years. We're thrilled to have you and recognize you in this, with this recognition with the family physicians. You're so deserving. You've had a great full career with the Public Health Service, but in family medicine primary care with the Public Health Service and then with the Utah Department of Health. We appreciate you. You have been a great leader and so compassionate and caring of patients and of coworkers, and supportive, and a great leader and very intelligent. And we sure have appreciated you, and greatly supportive and of this recognition and honor you're receiving.
Dr. Babbitts, thanks so much for the time that you've spent providing guidance to our programs. And while I couldn't be happier for you to have retired and moved into a new chapter of your life, I still appreciate that you've continued and maintained an interest in the work that we've been doing around the Health Workforce Coalition. And I know that you're always there if I have questions or need advice around that. And I look forward to continuing to cross paths with you, even as you move into this next chapter of your life. So thanks so much.
This is just so well deserved, and you are just a shining star in the medical community. And I can't think of anyone that could deserve this award more than you.
Oh, Dr. Babbitts, this is a well-deserved award. Thank you for everything you've done, for the foundation you've set for all of us, and for continuing to walk alongside us as we make a difference as family doctors.
First, I just want to say thank you to the Academy. I'm really honored and pleased that you recognize my career by giving me this wonderful award as a family practice champion, because I do feel like throughout my career I have been a family practice champion. But I was a rural family doc for 9 years, and that experience in a rural community absolutely convinces you how critical and how important family medicine is. We did everything in our practice and really saw how important it was to have a family doctor who cared for families. And it really was cradle to grave care during those 9 years. I remember the American Academy years ago had a great slogan, which I've always loved, which says, "Every family deserves a family physician." And I believe that from what I've seen in my experience. And it's just sad these days to find places where people don't have that opportunity. And even now in my little tiny remaining practice of half a day a week with the state clinic, I see patients. We're mostly doing adult care. We rarely see a child, but it's pretty much all ages of adults. It's been a great thing to get to know patients, have them know me, and be able to help them with their health problems, but also help them just as people, because in family medicine, we really enjoy the person. I used to tell students, and I like this phrase, there are many physicians, and they tend to be our subspecialty colleagues, who are really interested in illnesses that happen to take place in human beings. Then there are family physicians who are really interested in human beings who happen to get illnesses. And there's a real difference there. I really care, and as you do, we care about the people, and we help them as they go through different stages of their life and face illnesses, face emotional issues, face family issues, face financial crises, insurance issues. We care about the person. That's our primary interest. And the illness is almost a secondary thing. We'll help them get through that, but it's just part about caring for the person. I'm really honored. You are my colleagues. Many of you are my friends. Some of you are my former students or residents. It's just a great honor to have you recognize my career and provide me with this award. It's a wonderful, fitting tribute. And some people would say, it's really nice to get an award like this while you're still alive, even though I've retired. Some of these things come posthumously. So I'm glad to have it when I'm still kicking. So anyway, thank you for that. And thank you to the Academy leadership and to Marianne and Barb for all their work in making the Academy what it is today.